Another COVID-19 related death, bringing the total number of deaths to 29. The Ministry of Health says the latest death is that of an elderly male with pre-existing health conditions. The announcement comes with the news that 43 more persons have tested positive for COVID-19, bringing the total number of active cases to 1,255. However, the ministry says the figure is not representative of the positive cases in the last 24 hours only, as the samples were taken from the period August 28th to September 3rd. North Central Regional Health Authority's CEO, Davlin Thomas, is denying that any COVID-19 patient has died as a result of a lack of care from the authority. His statement comes after the TNT Registered Nurses Association President Idi Stewart alleged that a patient did not receive their dialysis treatment in time, which led to their eventual death. Sunil Lala has more.
The TTRNA is calling for the immediate resignation of the Chief Executive Officer of the North Central Regional Health Authority, Davlin Thomas, after it says some questionable decisions have been made with regards to the management of the COVID-19 facilities and healthcare workers. TTRNA President Idi Stewart claims that the NCRHA placed over 20 junior nurses in both the ICU and HDU areas where he believes specialist nurses should have been. Additionally, he alleges that a COVID-19 patient died as a result of the NCRHA not having a nurse to operate a dialysis machine at the Couva Hospital.
A dialysis patient dying at Couva. And I want to tell that family, because I was privy to some of the communication going back and forth, trying to get a dialysis nurse to go up to Couva, and the frantic attempts by the family to have that done. And in the end, it was too late.
But this was denied by NCRHA's CEO, Davlin Thomas, who says the patient who needed that care received it.
The person who originally was on shift apparently was in an accident, and therefore we had to call in someone else to do the actual CRT for that patient. And what essentially we would have had to do was to get someone through the director of nursing for the country. The country doesn't have, it's not a service that there are many pieces of equipment within the country to do it.
Meanwhile, the TTRNA president also alleged that the general manager of the NCRHA recently resigned due to her inability to influence nursing decisions, adding that she was unable to convince senior administration to listen to advice from nurses and midwives. However, he acknowledged that the general manager did in fact resign, but says it was due to other factors.
A few months ago, the GM, when COVID-19 started, the GM has health conditions that have a correlation with putting her at risk, and had been asking to be able to step aside. We asked her to hold until we had someone who she would have identified.
The TTRNA also claimed that the specialist ICU Cuban nurses who were brought to TNT are not actually competent in ICU and have not been working at the Couva Hospital. Mr. Thomas, though, says he is unsure where the TTRNA is getting its information, since these nurses are functioning at the hospital. The TTRNA, meanwhile, says it intends to write a letter to the Health Ministry and the Prime Minister demanding the resignation of Mr. Thomas, and is threatening to ramp up its action if this is not done. Sunil Lala, TTT News.